going to be on for a minute.
We're live. Hello, America. Here we are. Lisa appears to be in her place of business. I am in rural Pennsylvania, where my mother says, don't worry, she got the best Wi-Fi available in the Lehigh Valley, which is still to be determined. Melissa appears to be in New Jersey, and we have Audrey, who is joining us from New York, mostly to chaperone us. And then we have Natalie Schneider, who's our special guest for later today. So
we do need chaperones, honestly.
Yes. Yeah. Problem is I mean, Melissa is usually our chaperone, but
yeah, that's true.
You know, the problem is
she's like, stop talking about that. Stop it.
Let me help cameras before I get associated.
Yeah. All right. We're going to send Natalie and Audrey back to the backstage so that, you know, no one assumes that anything we're saying is associated with their opinions and viewpoints. Melissa, we'll send you back too. You know, you can just yell at us if we screw something up. But Lisa, what is going on? So Lisa's been business maxing.
I mean, honestly, I don't ever want to hear about me not being a capitalist, because what am I doing here besides making friends, influencing people, doing business, meeting new potential business partners? It's great.
So Lisa, are you saying that you are no longer capitalist curious and you are now a capitalist?
There's nothing else to call me. Nothing else you can say.
I'm just glad, you know, I've been writing all these like mushy LinkedIn posts about how as a right of center person, I sometimes change my mind and I don't hate people. And look, guys, I made Lisa hate people. It goes both ways.
I still love people, but I do a lot of business now.
Yeah, she does the business. She knows the money. She knows the margin. It's no big deal.
That's right. That's some contracted annual recurring revenue.
So listen, so you guys, this episode is sponsored by Fort Health. Natalie is CEO of Fort Health, and we're excited to talk to her about youth mental health, all kinds of cool things going on there. Maybe we'll ask her about the Support Act. Maybe we'll ask about we're probably going to ask her a bunch of things. We don't know. So we'll see what happens there. But for the next 20 to 30 minutes, you've got us rambling about bullshit. The first of which, did you know the Pope hates AI?
This guy. So first of all, I like the last Pope for obvious reasons. And this one is even better. He studied mathematics. He is from Chicago, depending on your orientation. There's some fighting about where he's actually from.
No, he went to Villanova. He's from my motherland.
Okay, but
the promised land.
Sure. See, this is the fight. This is the fight people are having. This guy understands what he's talking about. This is actually a really good piece. I was very surprised to read it. He's super thoughtful about it. Like, I don't know, man. I think I'm I'm not generally supportive of anyone's particular church, but this guy, he's got some good ideas.
Okay, but so I actually read this article. Lisa, be impressed, because sometimes I do read the things you send me.
You can just read the headline. I'm confused.
No.
Wait, what's happening?
So,
okay,
no, I'm no longer a capitalist. Anyway, no, that's not true. I totally am. But no, listen, I read this article. Did you know, Silicon Valley tech bros have been making their pilgrimage to the Vatican to convince the Vatican for fucking years about why they should love tech bros? What?
Sure did. In fact, the Vice President of the United States of America, J.D. Vance, who is a Catholic, is also friends with many of the same Silicon Valley folks. So I imagine there is some connection there. But absolutely.
Yeah,
absolutely.
I did not know. But I'm kind of I'm into this Pope Leo, and he took his name because it was
his name.
Shut the front door.
This guy, he's like, AI is a threat to workers' rights, and you know how I feel about workers' rights. I do.
Anyway,
you're drinking wine and I'm drinking a coffee, and there's something wrong with this
Lisa,
picture. It's not.
I'm
fair.
At my mother's house, and it is
true.
There's
no water. Here. It's literally just wine.
Old mom, my mother.
Speaking of Jesus Christ. Turning the water into the
wine.
My
mother does not eat carbs except for wine, and she does not allow me to eat carbs when I'm here except for wine.
It's just wine.
There we go. It's no big deal. What are you gonna do? I mean,
say hi to your moms. Who?
Yeah, Olma says hello to all of her adopted children, including Lisa.
Right.
Okay. Also, speaking of AI, apparently Commure does the AI, and it raised a shit ton of money. Lisa, I did see this on Health Tech Nerds, where a lot of people were like, "What does Commure do?" And no one, including you, could really tell me.
I absolutely could. I mean, here's the thing, right? Some companies build their technology and some companies acquire their technology. And Commure is a collaboration, conglomeration of a bunch of things that were acquired. That's a little bit of shade, and that's fine because I can be shady here. And they're really trying to do like all the data infrastructure things. And that's, I mean, sometimes it works, sometimes it doesn't. But when you buy stuff, it's really hard to integrate it. Remember what I say about policy and implementation? Same thing about buying a company and actually delivering on it. It's really hard.
Well, Lisa, the only thing I saw from that long health tech nerds thread was that Commure wants to be like Innovaser. That's what I saw. They want to be
Your
like
words,
Innovaser.
not mine, like
I don't
loyal
know.
fans.
Well, it's
So
hard, I will say I do like that there is a lady medical doctor CEO of. Do you say it Commure like communism or
I don't know,
Commure?
but I think you should, whatever you just said, I support.
Okay, whatever. Anyway, I don't know. But so I only read headlines, and so when I Googled what does Commure do, it said an AI technology company or something like
Yeah,
that, and I was
sounds
like, well,
familiar.
this sounds like something the Pope hates, and therefore I hate
Sound
it too.
the Pope
So
is against this.
the Pope does not approve.
When you've lost the Pope, I mean, yikes.
Okay, well, we don't actually know if the Pope doesn't approve of this company
We
because
don't
we
know,
still
but
don't
we're
know
just
what it
gonna
does.
assume. We're gonna assume. We're gonna
You
assume.
know what? Maybe they want to come on our show and tell us what they do. We'll see
Yeah,
what happens. TBD. Anyway, good for
that's
them.
right.
It's always nice that companies raise a lot of money. I'm here for it.
But actually, there's one thing in the thread you didn't read is that it's actually, and I don't know the full details to be fair. It's actually it's like a debt financing vehicle. It's not totally
Oh, yeah.
straightforward like VC money. So there's some kind of subtlety here, but yeah, General Catalyst is very creative with their funding mechanisms. That's all I can say.
Oh, yeah. I did see some of that. I always feel like when people start putting that stuff out there, I'm like, I don't need.
Complicated,
I just,
complicated.
I just
Yeah,
move on to the next thing,
that's
Lisa. I
right.
don't have
That's
time
right.
for that. Yeah.
I
Anyway,
pay in
good for
cash.
these guys. There's a
I pay in
yeah.
cash.
Cash is king. I totally agree. Sometimes you get a cash discount. One time I was buying some oysters at a market and they gave me 2 free
Mm,
oysters because I paid in
mm,
cash. That's right. That's right.
pretty big
That's
deal.
how it works. Yeah. I mean, it's hard to be that way. But anyway, there's another company called Tenor or something that raises a shit ton of money. All I know
Yeah.
about that company is it reminds me of Fiverr, which makes it sound like it's not worth any money, but apparently it is. So
A more
Lisa, what is this?
expensive version of Fiverr.
What does that company do? I didn't look it up. I didn't look
I
it up.
don't know. I don't know.
No,
It's too
okay.
much. It's too much detail. Oh, let's do a fast. Let's do a Google. Oh, no. Yeah. Ooh, it says facts in it. Never mind.
No, feelings are not
Never
facts,
mind.
and facts are not feelings,
We're
Lisa.
not
That is
faxing.
the problem. Okay, no problem. Well, we'll move on to the next thing. The reason
Oh, uh-oh. The internet in rural Pennsylvania is not working well, loyal fans. We lost her. Um, well, she tries to get
Yeah, well, I'm back.
reconnected. Oh, there you go. Okay,
Listen.
great.
My mom says
Listen.
this internet is better than Starlink, Lisa.
Okay,
She said it's
well,
better than
I'm not sure
Starlink.
about that. Not
Yeah.
sure about that.
Anyway,
Not sure about that.
tell me about this because this sounds like absolute bullshit.
This is total BS because one of the things that we talk about is like, okay, ideally don't do your business with like fraudulent things like fraudulent upcoding or, I don't know, stealing money from Medicare or whatever else it is. Well, in this situation, like something made its way all the way to trial about, this company like upcoding illegally. And the only person who went on trial was like literally the coder. And
Like
let
the
me tell
coder.
you, it's not the coder who made the money off of the fraud. And that was the whole thing. They were like, she's like, all she got from it was like her regular salary. So like, why are you taking her to trial? Like, she's not the one. These are like corporate decisions to defraud Medicare, not the decisions of like an individual coder. So like, be ashamed, truly.
Be ashamed. That's
Be
right. Okay.
ashamed.
Well, yeah. So the reason we didn't know what Tenor did or Commure is because we were focused on regulations, mostly comment letters. And
Oh,
unfortunately, most of the hilarious comment letters that we saw earlier were in a disappearing signal thread, so I lost them
that's
all.
right.
But
That's right.
don't worry, fellow loyal fans, we actually tapped someone who actually really cares about comment letters to give us the best ones. But Lad Wiley, epic very important person at Epic, most important lobbyist alive. He won the best lobbyist of 2024 per the Health Tech Talk show in our
That's
best
right.
and worst of everything show. Epic put together, along with some other people, a letter of support about the provider directory initiatives going on over at the CMS. Like in general, like I'm supportive of this.
I mean, directory, well, provider directory that is like created by CMS is a little bit communist, Kat. I don't know if you realize what you're supporting there. Like,
I
I support
mean,
this, right? But like, like I agree there are some things the government should build and be responsible, some fundamental infrastructure the government should be responsible for. And
listen,
that feels like
I
what this is
agree.
to me. Okay,
I
okay,
agree. I
okay.
agree in
All right,
fundamental and for
all right.
Lisa, I hang out with you a lot, so this is
That's
what's
true.
expected.
That's
But
true.
no, listen, do you even know that I would be supportive of TEFCA, one, if they adopted our name, the Freedom Health Data Network, and
Which we will
two,
still offer for free, by the
if
way,
they decided
government.
not to be halfway communist and just either went full on government
Yeah,
support
that's right.
or like made the private sector do it, and like whatever the hell is going on between here, I am not into. But
We are
anyway.
currently like putting out there like Joe Grogan bait when we keep saying that something is communist. So Joe, I hope you're
Yeah.
listening and you're
I hope
enjoying
Joe's
our
watching our show. Oh
I
my God.
really hope
Oh my
you're
God.
watching
Well,
our
you know what? Well,
show.
here, look, I made this slide because we're about to go into the sexiest part of the internet, which is regulations.gov.
That's
And
right. The
no,
best.
but before we go in, but we have to leave a little Easter egg here, or I don't know if it's an Easter egg or not, but Dr. Tom Keene, who's apparently a medical doctor, according to the internet and everybody who
He's a
knows him,
radiologist.
and him.
Radiologist.
He said he watches our show all the time. So we got to say something here so that he can confirm that he did in fact watch our show. He says he's always watching the show. I don't know, Lisa. What are we gonna do?
Interesting. Interesting. Okay.
I don't know. I tried
Great.
to find some dirt about it, not like dirt, just like interesting
He's just
things
like
that
a
we could
really nice
drop.
guy who's a
It
medical
seems like
doctor
he's
and
just a
yeah,
normal
he's
guy.
like
It's
a
like
nice
kind of
guy.
unfortunate. Well, it's
No,
unfortunate for us.
I don't think there's any dirt on him. Like he's very nice.
No, I was like, oh, does he love magic tricks or like
No,
does
he's
he?
just
I don't know, like whatever. I was just trying to find, and it
his like
appears he's a
opening his
regular
open
normal
his
person.
opening thing at the CMS ONC like thing at HHS was like I'm the biggest nerd in the room. That was like basically his like opening joke, if you recall. He was like, "Hi,
Yeah,
everyone's here to
that
talk
guy's
about
not the
my nerdy
biggest nerd.
ideas."
There are so many other nerds there. Oh my god, that was like the nerdiest nerd party I've
Nerd
been to in a
fest.
while.
That's right.
But
That's right.
anyway, well, medical doctor Dr. Tom Keene, if you do in fact watch our show, I don't know. I don't know. Just tell us later. We'll find out. We'll find out if you didn't watch this
We'll
show.
find
Anyway.
out.
All right. Okay. All right. Moving on. Okay. So like I said, we couldn't figure out, we couldn't remember which comment letters of them. We could remember, but we couldn't find them again. So you know who we turned to? Brendan Keeler, second biggest nerd on the internet, other than Lisa, who is also very online. He let us know his favorite comment letters, from the most unhinged to the most reasonable. So he said this is actually the most unhinged, maybe not most unhinged, but most ridiculous one.
Nice.
There's a gentleman who, well, anyway, submitted a very interesting comment letter, basically about HIPAA, but like anyway, you could just follow him on the internet and find out. And then it turns out this gentleman, who does appear to be unique, is also officially a persona non grata in the Northern Mariana Islands in the Great Commonwealth, one of our great territories, by the way, America, in case you forgot. So that guy's just out there on the internet. There's a whole bunch of articles
They're
about
like,
him.
get out. You are not welcome here.
Yeah. So
Never talk to us again.
You know what I think about the RFI process, and like props to here. Brendan's here. Yeah, these are all his, in case anyone forgets. Like what's crazy about this, like we have a couple others that are his favorite in here, and it turns out like a lot of people are using the comment period in these things as like just I don't fucking know, like a free for all.
Well, Brendan and I noticed this, like, like pump and dump scheme for, yeah, there was a whole
Oh
variety of
no, it's
weird
coming,
stuff.
it's
Okay,
coming.
sorry,
So
sorry,
read his
sorry.
Twitter.
Okay,
Go
keep
on
going.
X and like read his
Well,
thread, because there are some
I
funny
have
ones.
read his tweets personally. Are you telling our
Well,
loyal fans to go read his tweets? Okay, fine.
okay, well, Lisa, I only read the thread that he sent me.
Well,
So
I read almost everything Brendan writes, so I feel
Oh,
like I
oh.
win this one. Yeah. Aw.
Yeah. Well, of course you win, Lisa, but like who does the PowerPoint deck? Me. So, I don't know what to
That's
tell you.
right.
But
That's
anyway, he
right.
did call out, this is a friend of the show, Rachel Jones. She's actually been on,
That's
CEO of
right.
Syntax Health. Apparently they had a legit letter going in, which apparently, according to this thread, and the few letters that I did open and read before I decided to just text Brendan, they were all pretty unhinged. This one apparently was very good. So good for them. A little fuzzy, but light years ahead
Yeah.
of the junk. That's what
Yeah.
I'm talking about.
That's
That's the
right.
kind of Brendan Keeler comment that I would like to get about myself one day.
Mostly fuzzy, lots of
Fuzzy,
junk.
but light years ahead.
Oh, I was just saying lots of junk.
Anyway,
Inside
okay.
joke.
So
Inside joke, loyal
he said
fans.
that he said number one remains the pump and dump Clover Health.
Guys,
Lisa, tell everybody what this was. Tell
this
everybody what
is
this was.
funny. This is funny for us, but like don't use comments like this. So basically like this is just like that like Wall Street bets kind of like trying to, bump a stock through some kind of mass market manipulation on Reddit or whatever. And this is what happened, right? They were like, go and, support this post, go and put a like one-liner comment in this CMS comment place on regulations.gov, basically saying like Clover Health can already do this. Clover Health can already do this. That was like most of the comments.
Oh my
And there
god.
were a bunch of them. This kind of
So
stuff
good.
is so dumb. Like, I don't know what this does. I don't think that it actually like juiced Clover's stock, but
Do you think
God
these are just a
bless.
lot of AI comments? Would the Pope
Yes.
approve? I bet he would
No,
not.
absolutely not. The Pope would not approve. Pope
Yeah.
Leo says no.
Pope Leo says no, America. Boom. Anyway,
Yeah.
so oh yeah, so then he I actually, Brendan, look, I read your stuff. So then
Aw.
in here it says there's a bunch of other companies that did something a little similar, this counterpart assistant. I don't know what the hell that is, but I will say, of the like maybe 11 letters that I opened, 3 of them did mention this Addison Care. So listen, I feel like I'm really great at PR. I would never have thought to use a comment period to promote my company or product. I think that's stupid. And I actually, like, right now I'm feeling kind of stupid that we're giving these companies airtime. But I will say, like, despite this being Brendan's daughter's name, I bet this product is dumb. Like, having no context. I think if you're using an open CMS comment period, it's probably just like not good.
This is not an effective way to market your product or to juice your stock, guys. It's really not. Like, leave this to the nerds who are going to write like nerdy comment letters, call it a day. The end.
Yeah. Leave it to the Brendan Keelers of America.
That's right.
Okay, so we're going into like a little bit of wait. Do we have any other good comment letters going on in here?
I mean, I wrote one, my eyes were bleeding. Brendan wrote one.
Was it good?
I think mine was pretty good. I mean, I don't know, Brendan, you can tell the public if you think it was good or bad.
No,
It
listen,
was
here's the thing.
hard.
I didn't
Oh,
want to read the good ones, Lisa. Like I
yeah.
read the one you posted. I read Brendan's. There's a couple other ones up there. But like the problem was they were not unhinged. And therefore they did not
Yeah,
make it
no, it
into the
wasn't.
Hope That
Mine
Talk
was
show.
the one we wrote here was Ed for Innovator, and the one that Civitas wrote, and some of the others, the one that Brendan wrote, the one that the innovative kind of structure that Josh Mandel used for his work. But they're not unhinged. They're like policy recommendations. They're
Mm,
just
mm.
regular, degular, schmegular policy recommendations.
You know what I think is annoying about comment letters? How many companies just submit their brochure?
Jesus, probably a lot. Probably a lot.
Like, I mean,
But this is
I don't
my
know.
advice to everyone is I think you should talk to the government. No, you do not have to follow their structure. You can write just a simple letter. Some people did. You don't have to answer every question, and you should write something that you actually have a perspective on. Don't just write it because whatever. Like I skipped a ton of questions because I was like, I don't really have a perspective on that. Slash the company I'm representing doesn't have a perspective on that. We don't have the right to speak there. We don't have experience. You can just say things, but don't write like you should choose Clover Health. That's not going to happen. Like whatever. Write something real. And any company can do
Or
that.
you
Any
can call it
person.
or you can call attention to the fact that apparently 90% or something like that of the healthcare workers in the Northern Mariana Islands are not licensed in the United States of
Yeah,
America.
yeah, true. Big problem. Big problem.
You could tell people about that. I feel
And
like,
you know what?
well,
Nobody cares. We are giving them more airtime than they have ever had and will ever have.
moving on. Okay, so
Moving.
Headspace, behavioral health. mental health care on the internet. So I actually read this headline and I was like, what the hell? Like I thought they were D2C, but this is apparently now they accept insurance. So that's exciting. I didn't know that. Lisa, I
Like
don't know if
God,
you
like
remember
Godspeed, Godspeed.
one year, Lisa, I don't remember which year it was, but I got you a subscription
I,
to Headspace. Did you
I
ever
am
use it?
aware. I am aware. And yes,
Did
I
you,
did not for therapy, but for meditation.
well,
And
yeah.
now, by the way, on my probably can't see this on my phone. There's Headspace right here, but it's not for therapy because
No, it
God
was
only
just,
knows that
well, I don't do headspace therapy because I believe in real therapy, woman to woman,
woman to woman. I
and
just
Marco Polo with Lisa.
like
But
everybody, you know what? Any company that is like has I mean, DTC is so hard. Number one,
it
so
is
hard,
super hard. So why do
so
you think
hard.
they're doing that? Do you think they're hurting for cash or do you think they have so much money they want to blow it on DTC?
I mean, I think they believe that they already had a right to compete in the space from DTC
The
because
right
they
to
are an app,
win?
the right to win. Because like they already have, some X number of like active subscribers or whatever. But you know what? Like first and foremost, DTC like therapy apps have had a very like questionable, amount of success. There's been lots of issues with them. We may talk about that in a little bit in various ways, but like I just I are we missed is BetterHelp and their competitors not enough here? Is there some reason why Headspace will be different? Is it just that their therapists are going to be like, you should meditate. Here's the meditation you should do. Like what? Like I I just I
I
don't
bet
know
it's
that
not
this is
that.
really the
Well,
time.
Lisa, I didn't read more than the headline, so I don't
Sure.
actually know. But it sounds like this is like a new offering. Because yeah, the thing that we have that I honestly haven't, I had to turn off the notification because every day at 10:15 it would tell me I hadn't meditated that day, so I had to turn it off. But I don't think they had any sort of therapy on there. I think it was just like,
No, no, they don't.
close your
No.
eyes and breathe, y'all. So whatever. Anyway, good for them. I know that a lot of these companies are struggling right now, but there is also a shortage of behavioral health providers, which our special guest may talk to us about in a little bit here.
Yeah, but like,
So
but how in the world could this ever address that? And by the way, one of the biggest like barriers to like national telehealth offerings, because like alert loyal fans, America isn't just America. There are 50 states and a bunch of other jurisdictions, and like weirdly, like licensing for clinicians is done at like the state and the jurisdictional level.
so
And these
weird.
companies, yeah, and it's like a huge burden. There's like major problems. We have a bazillion insurance companies. There's all different rules. Like, there's just, it's not particularly easy to have a national telehealth offering in mental health or otherwise. And I don't know, again, like why they have the right to win here, what's going to be different here. They must have some money to burn. Like, if you
Hmm.
work for Headspace and you're mad that I'm kind of dissing you, come on the show and tell us about it.
Yeah, we would love to have you so you can tell us
Yeah.
all about the thing I hate the most, which is direct to consumer anything. Hey, Lisa. In general, what do you think about the RFI? Like, do you think like I feel like the CMS and ASTP people did a good job, like opening up their arms to receive a barrage of ridiculousness, and they may have some gold. But like, what do you think in general? Do you think it
Well,
was
first of all, like the amount of ridiculousness that's coming towards them and what's in those comment letters is nothing new, right? CMS gets all kinds of nonsense all the time whenever they have an RFI or whatever, or public comment opportunity for anything like a regulation or whatever else. So that's fine. I love the idea of the government supporting a robust health technology ecosystem, but the ecosystem players need to also step up. And that means acknowledging that we have to compete and we also have to cooperate. And that's something that like healthcare and health tech hasn't been especially good at. I think a lot of health technology has really been based on the idea that there's like all of this regulation and all these requirements and certified health IT and whatever else, and money from the government for different things. And I would love to see more of a focus on building and supporting and reinforcing the things that have to happen for there to be a strong like health technology ecosystem, which ecosystem is not the same thing as like the government has chosen one winner to win the health technology wars, which is kind
Right.
of how we've approached it before. So TBD.
Yeah. I mean, yeah, I agree with that. I also saw something from Politico where maybe they use the AI to just analyze them all. They're like, appears to be some support for Tefka. And I was like, what is it? What even is Tefka anymore? Like, what the hell even is it? Because all the things people say that they wanted to do makes it like not Tefka, which again, like if they want to call it the Freedom Health Data Network and they want to do all those things like
Free idea.
claims and
Free idea.
case report, like if they want to, like we already made the logo, Dr.
Free name,
Thompson.
free
We
logo, free
made you
idea.
the logo. And I
We
know,
are doging ourselves. We made everything's free. We're gonna give it to you.
yeah,
It's amazing.
free advice club, the free design
That's right.
club, the
Free
free all
advice
the things
club, free
club.
design
Yeah.
club.
And listen, I know you guys have a lower budget this coming year.
That's
and
right.
listen, you're
We
not
did
gonna
it
have
already.
to hire, you're not gonna have to hire a design firm for like $400 million. We will hand that art over to you. No big deal.
Tefka is a flat circle. That is correct.
Listen, I will also be supportive if you call it the Freedom Health Data Network, or at least include some flame emojis in your new design.
It is everything. It
And
is
and
everything
also,
to everyone.
if you mandate returns for patient access in a meaningful,
That's right.
easy way, that would be
Um,
fantastic.
Brendan says here also that the level of abject and outright shilling is new. I disagree, but also kind of a question for our loyal fans. Like, should the Health Tech Talk Show create the Freedom Health Data Network coin? Should we have our own crypto coin so we can also be part of the shilling and the profiteering? Please let us know.
You know, those are things I
And
love.
yeah, yeah, yeah. Speaking of shilling.
Yeah, I mean, hello. Jim Nasser, didn't he offer to make us a coin?
He did. We never felt we're too lazy because it's like our 40th job, but it's fine.
Yeah. Well, I feel like we could find a way to run a crypto
That's
scheme
right.
for
That's right.
sure. And see what
That's
happens in
right.
our copious free time. Okay. All right. Moving on here.
All right.
So,
All right.
in other behavioral health news, so we didn't have a show last week because Leslie and I were sponsoring our favorite nonprofit ever, other than my own nonprofit, obviously. We went and we were like basically the number one sponsor of Project Hope. This is their annual fundraiser, Hope Bloom. So everybody should give Project Hope some money because they're amazing. They are a recovery center for moms and their children. So you don't have to separate moms from your kids as they recover from opioid use disorder and actually any substance use disorder. So super awesome. It's amazing. This model in Huntington is like the best. And Leslie and I do whatever we can to spread the word. We even I picked up this guy, Stephen Patrick. Apparently he's like a big deal at Emory, like runs the School of Public Health there. I met him in Minneapolis at ARM, where I tricked them into letting me open up their conference. And I convinced that guy to come to Huntington. He totally showed up 6 days later. And everybody else should do that too, because now they're going to collaborate and do stuff with Marshall University. Listen, you guys, this might be a very difficult place to get to, but it's totally worth it. So if anyone wants to come, listen, Leslie and I will meet you in the Terminal D Sky Club. It's brand new in Atlanta, and we will fly there. We will fly there with you, and it will be great. So these people are awesome. The woman right in the middle is Dr. Lynn O'Connell. She runs Project Hope and
Did we have her on the show?
We did. Lynn was on the show last year around this time because the Hope Blooms is at the same time. And then over here on the right is Sonia Chambers, Executive Director of the WIN, also known as the West Virginia Health Information Network. And then we've got some trophy husbands and partners here. And then we have Buffy right next to Darshak. And Buffy, as far as I can tell, runs Marshall University, but it's unclear what her actual job is, but I'm pretty sure it's CEO. She's the best. Yeah. Anyway, everybody should come. Here's me and Leslie receiving an award for being amazing.
You look so formal and fancy.
Oh yeah. Well, here's
the
problem. I was wearing my usual black dress, but it was known to us that we have to wear Kelly green, which is the school color of Marshall University. And the green, first of all, this is not my color. I don't know if you can tell, this is not my color. And so the dress I bought didn't fit, and it also didn't look good on me. And then I showed up. Sonia was like, "Why are you not wearing green?" And she dressed me. So this is me and Sonia's
Nice.
blazer. Leslie was smart enough to get her own skirt, so she looks fantastic. So yeah.
Great.
Okay. All right. Just in time to talk to our real guests, so the audience can get some relief from whatever the hell we're doing, Lisa. Oh my God. So here we go.
Drinking on the job.
Well, are you drinking anything other than coffee now?
It's fancy coffee from Phil's, which is like a iced rose coffee. It's really good. It's an
Oh, well,
SF
that's
thing.
nice. Well, I feel like I'm way ahead of you there. All right. Natalie, hello.
Hi.
Natalie.
I didn't know this was cocktail hour. I've actually got a
Oh yeah.
bottle of Prisoner right
You
behind
can
this
do whatever
laptop. But
you can do whatever you want to do. There are
not
no rules in the
uncorked.
Health Tech Talk Show. The only rules is that you aren't allowed to have rules. I think. So,
Well-
Natalie, will you introduce yourself and Fort Health to our adoring fans?
Sure. And thanks for having me on the show. I've been chuckling in the background. Great commentary. I'm the CEO of Fort Health, tech-enabled youth mental health. So the comments about Headspace, DTC, national models, etc., fantastic, and hope we continue with those. And our focus is on kids 4 to 24, mild to moderate. Very different strategy. So Lisa, picking up on what you said about what are the benefits and drawbacks of national, I was with Anthem, now Elevance, for about 8 years, so saw firsthand like healthcare super local. Innovation happens very locally at a zip code level. So we took more of a like local market density model, and we're in New Jersey, Texas, New York, Pennsylvania, Illinois, etc. And just in terms of personal connection, 5 kiddos between my partner and I, so we're seeing all of this unfold around the dining room table. But on a more serious note, I lost my mom to suicide. And we know if we meet kiddos at the point of need and we can treat them, it totally changes the trajectory of their lives. So that is what I am on a mission to solve for.
Right on. So what do you think about the Headspace move?
So what I think is really smart about that is they have the front of the funnel. And when you're in the front of the funnel, you may not always understand when you have a problem and a solution. But if they get people in the front of the funnel, as soon as a problem materializes, they're already with Headspace. So I'd imagine Headspace's hypothesis is they'd have an easier time converting. However, the drawback is those two models are so different. Your gross margins are so different. The operating mechanisms, they're like basically two completely different companies that you're trying to run. And Lisa, I see you nodding. What I've observed, and I'd love your feedback on this, is if you do sort of a classic McKinsey 2x2, they're models that are surfacing that are like totally change the game, like AI instead of therapy. And there's a place for that because there are a lot of people that are not getting any therapy at all. Okay. Then there are models that are saying, let's win in the existing framework, which is the reimbursed framework. And even within that, you split those two and there are low cost or high quality. What's happened in the last 12 to 18 months at a unbelievable speed is the number of companies that have moved to the low cost quadrant that are hiring exclusively 1099 because they provide very significant gross margin improvements. You can variabilize your cost base, etc. What I'm personally concerned about is that is then an independent contractor.
That's right.
You cannot tell that therapist, here, follow our clinical care pathway, take our training, and that same therapist, you know, if I was a LCSW, I could be working for Kat, I could be working for Lisa, I could be working for Audrey, and basically then the underlying product, which is the therapist, is commoditized. And those companies have rendered themselves to becoming really marketing and acquisition engines. And
That's
that is
right.
a perfectly fine strategy for access. And last thing I'll say is access was like 2020 to 2024. And I mean, it's so stunning, the change in the complexion of the conversation with payers now, that they don't want just that anymore. They're really looking for quality. So I think the pendulum's going to
Yeah.
start swinging towards quality.
Right. I mean, any of those payers or employers or whomever, benefits consultants, they can hook you up with a better help or somebody, like you can get access, like you said, to a network of 1099, virtual mental
Hmm.
health professionals. But as you said, it's actually illegal to force a 1099 clinician to follow a specific pathway because that would be like you're their employer. And that is a specific employment status that does not allow you to fully control everything they're doing. And there are obviously quality issues, especially with a complex population or
Mm.
for like you guys with kids. Like you just,
Yeah.
I think there are true limits to that model. And I think we've seen them. And I think you, like you were just saying, I think you can, okay, I can give you access tomorrow to, you can go on your app and search for this virtual clinician, done, set up an appointment tomorrow or even today, sometimes great. But that just doesn't get you to where you need to go. And it's not cheap, it's not free, it's quite expensive, in fact. I was just looking at the pricing that Headspace has put forth, and they're like, "Oh yeah, $150 if you don't have insurance coverage." Well, what's the difference there? That then, and there's no, I don't see a differentiator for me as a patient consumer, and I don't know. Like again, it's like mixing modalities is kind of what you were saying, Natalie.
Yeah. I think the tricky thing is that, I'll be honest, like even 3 years ago, no one really wanted to talk about outcomes,
Mm.
including investors. It was always in our pitch deck. We're evidence-based, we're measurement-based, we have our own proprietary
Okay.
platform, and we got acknowledgement, but no one actually asked to look at our data, which is really interesting. Payers appreciated it, but they were really saying, how many therapists do you have? What's your time to treat? Those were the two things.
Mm.
And now it's
Because they're
changing a
trying
little
to
bit.
meet like network adequacy requirements, right? Like they were
Right.
like legal compliance,
Mm.
And now a subset of payers
right?
are asking for engagement as well as quality, but we're not necessarily getting paid differentially for that. And there
Mm,
is a
Gotcha.
price tag for having your own platform, for making those investments, which is fine if you're a Lyra, and Lyra does do like a great job. They've published a ton. I think they've published like 20 peer-reviewed studies, etc. But they're at scale. So if you're still subscale, like Fort Health or many of our peers, you're delivering evidence-based, measurement-based care, but the industry hasn't really advanced yet to pay for performance. You're kind of in this tricky in-between period.
Yeah.
yeah, definitely.
So a question for you, Natalie, that I think will make Lisa's heart sing. So we saw from what Melissa told us, thank you, Melissa, that you primarily work alongside with primary care physicians. And one of Lisa's
Yeah.
ideas to save America and change the world, mostly America, is to just pay primary care more and make them more important. And it sounds like you, at least somewhat with your models, would subscribe to that thought.
Yeah.
What do you think about? Tell us more about how you actually work and what you think of just paying them more.
Well, yes, absolutely. I mean, they're the lowest paid specialty. Like they're the most trusted relationship in most families. And I don't know if you guys have kiddos, and they don't get paid much, and you're seeing a stunning number of them retire. And yet, my understanding is, you'll have to fact check this, but last year, not all residency spots for pediatrics were filled. Right, so
Hmm.
fewer people are going in, lots of people are leaving, and the reason we started on the strategy of really like surround sounding the pediatrician's office and kind of snap fitting into their practice was related to a conversation I had with a friend of mine. She's a pediatrician. She said, I'm quitting. And she said, I'm trained in primary care. However, my day is spent in 15-minute increments diagnosing and prescribing. I cannot go back in time and do a child and adolescent psychiatry rotation. And as I started poking around, I discovered, in combination with, we partnered with Child Mind Institute, they discovered that mental health is the most common presenting condition in a pediatrician's office right now. But they weren't trained to do it. 3 out of 4 kids that are diagnosed by a pediatrician. So, Lisa, when you look at like at a systems level, we have too few pediatricians and they are spending their time as frontline behavioral health providers when they should be spending their time on primary care. And actually, that's the problem we're trying to solve, is to make it super easy to refer. Once they've referred, we provide clinical progress updates, discharge summaries, psychiatry reports. That truly is like an integrated model.
Yeah, yeah. And I think the thing that I really deeply care about, as many people know, is the moving the data and the technology to the background, especially when you're talking about kids. I really envision a future where not only are there like meaningful clinical partnerships and teams of different folks to support kids and other people who need support in various ways across physical health, mental health, behavioral health, other needs, right? That should be there without a doubt, but also that all of the data and the integrations and the technology and the platforms can move a bit to the background so that in that clinical encounter there can just be, your colleague or your friend just gets to work on, complex diagnoses, relationships, building trust with the patient. That's the most important thing that like any physician or any clinician can do, is actually having that human interaction. And we're not quite there yet, not even close with all of the technology pieces and the referrals and the systems, but like that is truly the dream there. And then in terms of treating kids in particular, you really need that integration between, physical health and primary care
Mhm.
and mental and behavioral health. You really
Yeah.
do. Yeah.
So is there space for a hybrid model? And what I mean by that is, let's say it's going to take a child a course of 16 sessions of CBT treatment to reach
Mm.
their treatment goals. And because we can't double the number of therapists overnight, we have a supply issue. Okay. Could we, in between those sessions, ingest clinical notes, ingest
Mhm.
the unified protocol, provide reminders and skill building in between those sessions so that we can reach those treatment goals in 14 sessions or in 12 sessions? Right. So I really have a strong conviction that in about 24 months, we're going to see a lot more of that. That
Interesting.
is therapist supervised interactions that are ring fenced, different from AI being the therapist, right? That allow us to be much more effective with the very short supply of therapists that we have. And then also paving the way for pay for performance contracts where you can
Mm,
say, we met these clinical outcomes, but we did it in less time. So instead of paying us for 16 sessions, we did it in 12. Can you pay us for 14? Right. And that feels to be
that's
a
interesting.
win for the parents, for the kids, for the payers, you know, for providers like us. What are your thoughts on that?
I mean, so I really love pay for performance. I really love pay for outcomes. Uh-oh, what just
Huh.
happened?
How did we do that?
Um, that's not the right one either. Guys,
There we go. Someone
There
hit
we
a
go.
button.
the
You never
gremlins, the
know.
gremlins are in our
You
system.
never know.
It's just me. So I love pay for performance, love pay for outcomes. I really want to see more folks in the, health tech space start to take accountability for outcomes. And I know there are all kinds of blockers and barriers, but it's so important. I believe really strongly that technology has to be able to be deflationary in some way. We cannot simply keep adding new billing codes. We cannot keep
Agreed.
expanding fee for service. If we believe technology is a differentiator in some way, we can deliver things differently, then it can't cost the same as having 16 hours of a in-person, mental health therapist in a room with a kid and a family. That doesn't make sense. So like, how do we get to that place where we can actually deliver better outcomes? And then, like you said, pay on those outcomes, pay on that performance, find a win-win-win. It can't be just that we keep expanding the balloon further.
Yeah, I totally agree. And I think payers are starting to ask the hard questions, which they should, because claims costs have gone up,
Right.
and
Mhm.
they're saying, where's the ROI? And I don't know if
Why
the
adopt
stat is.
technology if it's not going to make us better? What's the point? Then don't do it. Just don't do it.
Mhm.
I
Yeah,
mean,
so it's interesting. I think we're watching the whole mental health industry sort of grow up in real time. And, there are sort of a few themes that are emerging. You mentioned one with Headspace, and they have also this sort of digital companion, Ebb, that sort of follows you along and helps triage. So there's that model. Then you have, others that are kind of building more of a full stack. So Brightline building out brick and mortar. We're expanding into more services. We've just added collaborative care. So I think everyone is not only expanding, geographically
right,
or contracting, right? Brightline went from a national model, an employer, to sort of local market density. But sort of trying out these different stacks. So I think that's interesting. The second theme is personalization and moving away from this one
mm,
size fits all,
hmm,
which is quite interesting. I'm tracking Spring Health. Have you seen?
hmm,
They've got these contextual journeys,
hmm,
which
hmm,
makes a lot of sense if you are going through a divorce or some life event to combine content, therapy, etc., but really meet patients where they are. What are you guys seeing in the mental health space?
So I have a little bit of a question on the deflate. Like I agree, Lisa, right? If we're gonna add a bunch of tech, like at some point, like it has to actually save money, it has to be deflationary.
right,
But I think Natalie, kind of what you were saying there. Initially, it was an access problem, right? We didn't have enough mental health providers, and so I think some of it was like, okay, we're just adding capacity. But to your point, now people are starting to look at outcomes, right? They're starting to look at does your model actually work? Is your company actually providing a good service, and are there health outcomes to go along with it? Do you think with the fact we haven't solved access, but it's gotten better, I think I can say. Do you think that we'll see some of this deflationary activity simply because access has been addressed somewhat and now there's more competition, or do you think it's going to require some sort of regulatory shift?
We won't see deflation because I can just speak to kiddos, all right? Only 30% of kids needing help are getting it today.
right,
And the reasons are, it's always the same two things. One is the cash pay burden. So
Mm,
access isn't an issue. Insurance-based services and access are still an issue. I mean,
okay.
when we
right.
tell pediatricians we're providing psychiatry and we have 99% covered lives in New Jersey, I mean, the response is, that can't be true. Okay, so that's still one of the challenges. And then the other challenges is the wait list. Even when you call some of the largest hospital systems in the states in which we operate, they will either say we're not accepting new patients or
Right.
there's a 15-week wait list.
Mm,
So we hadn't really reached matching demand and supply. And I don't know that we'll get there because, even if you could find covered services, we just had a mom, for example, she has three girls. So three times, let's say, a $30 copay for 12 to
Wow.
16 weeks. I mean, it's still a huge burden. So we ended up enrolling her in collaborative care, which you have one copay per child per month, right? Different model.
mm.
Sorry, long answer to your short question, Kat.
Oh no, it's helpful. I think we have to figure out what's going on.
Yeah, I
Another
mean,
question.
I think that I want to say that One Medical tried to enroll me in a collaborative care model for something, and I was like, no, I don't really care. But it was interesting that they recommended that to me, somebody who doesn't have kids and doesn't have a huge financial burden of healthcare. I do think it's important though, because yeah, I mean, again, let's go back to like why copays exist. It's to try and dissuade people from using healthcare. And when we agree and we know what the outcomes are, something like mental and behavioral
Yeah.
health intervention for kids, like you shouldn't dissuade that because the payout and the cost the payout will be very high and the cost could be extreme to people's lives and outcomes. Like it's not worth dissuading. It's not worth dissuading them from using care.
Yeah.
So my question is, if you are in the majority of providers that's not using measurement-based care, what is the incentive to discharge a patient?
Mm-hmm.
Your LTV goes up, right? And this is what we always talk to investors about. Like, we are evidence-based, measurement-based. We discharge once treatment goals are reached, or once we get to a certain improvement in PHQ-9 GET7, right? That kind of abbreviates your maximum LTV for that patient, but it's
Right.
the right way to practice. So I think part of this is the responsibility of payers to start putting some requirements and constraints
Mm.
on providers. Because if you're an independent provider, this is a source of revenue. Why go expend money acquiring yet another patient when you've got, Natalie sitting in your seat and she's happy to come to therapy for another 10 weeks?
This is a really important point. I really think it is. I think in sort of in the common cultural understanding of therapy, of talk therapy in particular, there isn't an end date. There isn't it's not terribly
Mhm.
goal oriented. Like you said, it's not terribly contextualized. Now, that doesn't match the reality necessarily for every single situation, but I feel like the cultural understanding of talk therapy is like an unlimited come back every week or every 2 weeks or whatever it is, versus like targeted, goal oriented, like outcomes and evidence based in that way. I think that's really important. And I agree. But at the same time, like, I think, some payers do a good job here. I would say most payers are still dealing with a really severe problem of, ghost networks and insufficient coverage. And so
Mm,
there's a lot of people need to clean up their act in this front, like a lot of people. And,
yeah.
and again, not even just pointing just at payers, there's a lot of issues on all fronts. And, ultimately, I guess it works for a period of time for, let's say, psychiatrists to be in network with no one and just do whatever they want and charge the highest fees. But over time, like, what are we doing? Like, we have to, these parties need to come together because like there are mental and behavioral health crises all over the country, right? We can't just keep going like we are.
Well, I'd love you to get back on your soapbox around cross-state licensure
No
and
problem. I
credentialing.
will, as you can
I
tell.
He's ready.
Whenever
Always.
I'm on a panel and
Always
there's a
ready.
question about if you had a magic wand or just one wish, what would you sell for? It is the least sexy topic.
Licensing.
It is the one no one really wants to talk about, but we hire therapists and we have all of
Oh,
this unused capacity because you're just waiting. We've had our head of psychiatry waiting for her New York license to come through for months and months and months and months. And even on the credentialing front, I had to reach out to some of the most senior leadership with one of the payers and say, we have a long wait list of your patients. And what's going on with the credentialing? I mean, it just went on into perpetuity.
Mm,
So those are problems. It is not my space, but why can't there be like an Equifax for credentialing,
right.
right? That everyone pings it, this person is qualified, and it saves money on behalf of the payers and on us, because who's making money out of this efficiency, cross-state licensure and credentialing, other than
it's
the
just
credentialing companies?
it's so hard. It's such a states' rights issue. And they
Yeah.
have chosen, every state has chosen to like continue to act like a guild or continue to prioritize their local guilds for licensing. I think it would be, I think if any government administration, hint, hint, if you work for the government, and you're listening to this show right now and watching us, you want to increase access, like you could do this right now. You might have a war, but you could definitely
Yeah,
like preempt licensing in certain situations. And wow, would you increase access to care? Like somebody's got to work on this. I know people are working.
Yeah.
I know
Oh,
people, it's not just
yeah.
us, but like, man, this would increase access to care.
yeah.
It
It
really
is. It
That
would.
is a
that would
states
make
thing,
me
and then
very happy.
Yeah, I mean, think about who's making money now. Like the various organizations within the states are making
The
money, and like,
psychiatrist who's the only psychiatrist who's accepting new patients and can charge $2,000 an hour or whatever.
yeah. I mean, I'm
Just
pro
saying.
states, but yeah, I mean, this is, I mean, especially when we do have access issues, it's kind of bullshit. Hey, Natalie, what do
Yeah.
you think the Pope would think about all these behavioral health, telehealth companies that are using the AI? Do you think he'd be, like there was that, I mean, I don't use BetterHelp, but I saw on the internet that maybe they're using some AI. What do you think the Pope thinks about that?
I think the Pope probably uses BetterHelp. I mean, he got, if you're the Pope, how many
Man,
issues, he should probably get licensed. He'd make a great therapist.
he
Yeah, yeah,
That's
would.
my
yeah,
vote.
yeah.
He
Yeah,
already is.
I feel like
Clergy.
he's basically giving Lisa free therapy from afar from the
Listen,
internet. So, yeah, yeah, yeah.
I'm into it.
But what do you really think about it? There's been a lot of dialogue about AI and therapy and
Mhm.
how it's kind of bullshit and potentially harmful. Like, what do you think? And then there's also reports of
I
people using chatbots and actually like feeling better. So I don't know how to think about that.
so I have an unpopular point of view, but
Ooh, love it.
I think it has to play a role. It has to
Mm,
play a role. So let's really like giddy up and put the guardrails in place and figure out the policy and the regulation, etc. Because we cannot solve all of these access issues with more therapists. I mean, that's not going to happen.
mm,
So it would be my vote to start with hybrid models whereby you can kind of ring fence the interactions and just get to those treatment goals faster with the use of AI, and it is supervised by the therapist. That would be my vote.
mm. Lisa, how do
Yeah.
you feel?
I mean, I don't, I'm not excited about that being a solution, but I also agree with you, Natalie, that like the reality, like we're bumping up against reality, right? Like I think that's, a potential. Oh wait, did we lose her? Is she still there? Oh
Nope,
And
yeah.
she's
There.
back.
Okay. We lost you for a minute, Natalie. I think the
You're
internet
back.
hates us. The
I
the
think
Yeah.
the,
I'm
the Pope told the internet to stop
Yeah,
in,
the
broadcasting.
Pope heard us. He heard you say that
He
you
did.
were pro AI, and he
yeah,
was like,
No,
"This
we're
girl."
I just
we're
I think the reality is that people are already using these tools, and you probably need to have a safer way to do that. I think I
exactly.
wouldn't make it the focus, but I do think that we have to acknowledge the reality that people will use them. I am really deeply worried about the personification of AI and people getting confused, whether they intend to or not. I think we've had a couple of, widely publicized situations where people have, really, quite frankly, lost their minds and really, really bought into the personification and the sort of dangerous way, the no guardrails, open general purpose chatbots. I'm concerned about that. But I think there's plenty of great things that can happen. One of them may be EMDR, which is this really, really incredibly successful modality that is used by, I guess, some EMDR practitioners that does help people desensitize. It's kind of my non-clinical way of describing it. Uh, Certain, traumatic situations. There's all kinds of interesting tools that you could build around that really do
Mhm.
work in real life, that might get better with more technology. But I would just say, like, I'm cautious about that, but I also live in the real world, and people are in the real world using these tools right now.
I think it just
They
needs to
they
be
are.
labeled as such, right? If you're using whatever the hell, like if you're paying for a service and you think you're getting a therapist, like a human, and then they're like AIing you, like that's not
Yeah.
cool.
Yeah, that's not
that
cool.
should
Yeah,
that should be
someone was in the
disclosed.
news recently. I forget what company it was, but they discovered a lot of the interactions were AI. So I agree.
Yeah.
There needs to be disclosed, transparent, etc. But Lisa, I agree with you. People are using it either because they want just in time, or it's affordability, or it's a stigma, whatever it
Yeah.
is. It's going to happen for the people that aren't using therapy today. So the only way to combat that is to very quickly put the right regulation, oversight, etc., in place so that it can be done at least in a manner that we feel relatively safe about.
All right, Natalie, we are almost out of time, but we have a fan of the show, Mary Sarah, had a good question here. Does it matter whether behavioral health is fee for service? How many states have moved to an MCO model? What do you think about this?
So not sure I entirely understand the question in terms of fee for service. I mean, the underlying modalities are exactly the same. I think it's just an affordability issue. What do you think she means by her question?
I think she's going back to when we were talking about the being deflationary, which is probably not the word we should use, right? But like, is there a benefit to it going to a managed model?
So we're actually in a behavioral health managed care organization, Overwell, and there, like, theoretically, there are some benefits in terms of credentialing, etc. But no, I don't think there is a very significant difference.
Okay.
All right, we gotta bounce. Final words.
Yeah, final words for our loyal fans. What do you want to tell them? You got another like 20 seconds. What do you want to tell our loyal fans? I'm sure there are like thousands of them out there right now. Oh my God.
I want to tell your loyal fans that there is nothing better that they can do with their time on a Friday afternoon than to watch Kat and Lisa. I am definitely tuning next week. You guys are awesome.
Thank you so much. Love having you on the show.
All right, thank you. And thank you to Audrey, who is in the running for best PR girl in America.
Exactly.
Amazing.
That's right.
Yes.
That's right.
Audrey,
all right, thanks everyone. Bye. Have a great weekend.
Guys. Bye.